Once the baby's delivered, what we do is we give the mum the option of putting the baby up skin to skin onto the mum's chest so they can bond with the baby. And after that, once that time is over, then we do an examination of the newborn. So a midwife and a paediatric doctor may be there on site, and they do a full head-to-toe check of the baby. So usually it's just to see if there's anything that needs addressed or needs any concerns addressed straight away. Other than that, then what happens is the baby's brought straight back to the mum again. Yeah. So the full check entails from head to toe, yeah. And if there's any issues or concerns, then we'll address it straight away. So after that, then once the baby then is weighed, we do a weight on the baby, dry the baby, make sure it's nice and warm, and then what we do is we ask the parents, the mother, for consent for vitamin K. So it's an injection we give, a little needle stick injection into the hip for the baby, and this is to prevent any kind of clotting disorders for babies because they don't produce vitamin K themselves. So it just entails one injection at birth, and then that covers the baby then until they produce their own. So once the mum and baby have recovered in the labour ward for about an hour after delivery, they're transferred to the post-natal ward. On the post-natal ward then we do daily checks on the baby. So that involves putting a little sticky plaster with a lead on the baby's foot, and we check their heart rate, their oxygen levels, we listen into their breathing and do their temperature daily just to monitor the baby. If there's any issues with the baby and we think they may have jaundice, the slight yellow discoloration in the skin, which a lot of babies can get, we have a little monitor, billimeter, in which we just tap 3 times over the baby's forehead, and that'll give us a level then without having to take a blood test on the baby. So we're able to monitor the baby there. Also, before the baby goes home, there's a hearing test done, and that's done by a company here that come in and do the hearing test in the morning of discharge. So that entails a little probe is put into the ear for the baby. It doesn't hurt them at all while the baby's settled and asleep, and it monitors and it checks for hearing any deficits. So when the mum comes down to the postnatal ward after normal delivery, we check the mum's uterus for bleeding. We make sure that she's okay. We check her observations, which is her blood pressure, her pulse, her heart rate, and we settle them in with baby. We check baby as well at that time. With mum daily, what we do is we always check them every morning to see, and at night time throughout the day, for their bleeding, their blood loss. We try to check, or we administer pain relief, so we give them pain relief for any after pains they may have after delivery. So another important factor we have to do as well and educate mums on is passing urine and the bowel motions after delivery. It's really important. If they've had a tube in, a catheter, if they've had an epidural, when that comes out, it's really important to see that mum is passing urine and passing it well. So we'll ask her a few times and we'll document it down. How she's passing urine. If she has any issues at all or any worries or concerns, she just lets the midwives know, and we'll refer them to the doctor or the physiotherapist who will help them then to regain muscle tone and that. So if the mums have had a normal delivery, they usually stay with us anything from 24 hours to 2 to 3 days, if everything is well with mum and baby. On the other hand, if they had a caesarean section, they usually stay with us anything from 3 to 5 days on the ward. The difference then with the section is that the mum comes down and that she's in bed for at least 6 hours until the feeling comes back after the spinal. Plus also they have a small wound on their stomach where we check every day for them. We change the dressing only once before they go home, so we're not at the dressing taking it off every day for them. We also help out then with feeding, especially after the caesarean section, because they are in the bed for a few hours afterwards, unable to move. So they will be able to contact or call a midwife to give them help when they need it for the first day. So on the morning of discharge, when the mum and baby are ready for home, what we do is the midwives do a full check on mother from head to toe, make sure that she's well to go home, and also the obstetric team will come in and check, discharge her and give her a prescription if she needs for home. The baby then is checked by the paediatric doctor. A full head to toe check is done, and we have a list of that where they actually take off everything that's checked on baby, from hips and to heart, hearing, eyes, everything is checked. The hearing test is done in the morning of going home as well, so they'll come in and they'll do the hearing test on the baby as well. Then when the mum is discharged home, we keep the notes then, and what we do is we input everything into the computer, and it prints out over in the local health office then, where the public health nurses are. So their liaison office then distributes the information to the relevant public health nurses in your area, so that they will call to visit you within a 24 to 48 hour time, is what they achieve in the community.